Good evening. First at 6 tonight, the coronavirus is dominating the headlines. Some major developments in the past hour. Let's get you up to speed on them. First at the state capitol, lawmakers are postponing public hearings set for Thursday and Friday. All non-legislative events, including tours, are also postponed. The University of New Haven is suspending in-person classes through March 24th and canceling scheduled events and games. And New Haven just postponed its St. Patrick's Day parade that was scheduled for this weekend. We have reporters spread out all across our state today, covering all these angles. Channel 3's Susan Raff is looking at the state's response. Matt McFarland is covering the New Haven parade story. And Roger Suzanne is at Bradley Airport focusing on efforts to clean. Let's begin now with Susan. Susan?
Dennis, what we're seeing now is that the coronavirus has taken its toll not only in the world, the country, and heightened concerns here in Connecticut. The governor is now joining forces with hospitals, saying the state needs to take more action. Hospitals across the state have responded to the coronavirus with more training to protect staff and patients. Starting next week, Bristol Hospital plans to have 4 trailers outside to screen people with flu-like symptoms who may have come in contact with those infected.
We all know the message, folks. The message is we need to do our part as a community to protect our communities.
The federal government has now given Connecticut another kit, which provides an additional 600 tests.
And this one kit is simply the beginning of what needs to be done for testing.
Governor Lamont has now put a travel ban in place on state employees and is urging cities and towns to limit large gatherings. New Haven has canceled its St. Patrick's Day parade, and Hartford is deciding whether to do the same.
Nobody can be totally prepared for a virus like COVID-19, a virus that's changing every day, and the infections are accelerating every day. But we are working together on a collaborative basis to do everything we can.
People we spoke to say they do have concerns, but are not panicked at this point.
Am I concerned? Not really. Not until it starts to affect people around me.
Those general precautions which are taking, washing your hands, just taking care of those, not touching unnecessary stuff.
I'm a little concerned about it just because the fact that it's spreading so fast. What I'm doing is I, load it up on hand sanitizer.
The coronavirus is very contagious, and doctors here at Bristol Hospital tell us, similar to the flu, those at risk are those who have underlying health conditions and those who are older. But they also tell us that about 80% of those who are infected with the coronavirus seem to recover with no treatment at all. So this is why they underscore the need that if you are sick and not feeling well, you shouldn't go to work and you should avoid those who are sick. We're live in Bristol. Susan Raff, Channel 3 Eyewitness News.